Hello, my name is Rachel. Today I will be doing an ultrasound demonstration of the liver. I'm going to start with my patient supine, and I'm going to sweep through the liver in sagittal and transverse views. Deep breath in and hold, please, patient. So as I'm doing this sweep, I am looking at the liver's homogeneity, the contour. Breathe, patient. Deep breath in and hold when you're ready. I'm also checking to see if there's any pathology that I will need to address during this exam. I am also checking my windows to see what's available to me. Go ahead and breathe, patient. So my images are looking really good from midline and slightly subcostal for images of the right lobe, so that's where I'll be taking my images. I'm going to start sweeping through the liver in sagittal plane from midline to left. Can you take a deep breath in and hold, please, patient? So I'm decreasing my depth here. I'm going to take my first image at the caudate lobe, right about here. I'm going to sweep to the patient's left and see the aorta just posterior to the liver. I'm going to keep sweeping through, making sure it looks homogeneous throughout. And lastly, I'm going to look at this left tip here to make sure there's nothing pedunculated off. Sweeping through and it looks good, so I'll take the quick picture right through there. Breathe. Next, I'm going to look at the right lobe of the liver, sweeping from midline to right, starting at the same point of the caudate lobe. Deep breath in and hold when you're ready. So I'm going to start right about there. This time sweeping right. I am increasing my depth here to visualize the tissue posterior to the IVC. Breathe, patient. And I'm going to keep sweeping off to the right. When you're ready, deep breath in and hold. So I'm adjusting my TGCs here to make sure I can visualize all the way down to the dome. Next, I'm trying to get the main low bar fissure on this patient. The main low bar fissure is kind of short. You can see it right about through here. Breathe, patient. The main low bar fissure connects the portal system with the gallbladder, portal, gallbladder. Deep breath in and hold when you're ready. You could also lower your frequency to visualize this point of the liver. And I'm going to keep sweeping out. I'm sweeping all the way up to that dome. It looks good. Go ahead and breathe. So now I'm going to look at the sagittal right lobe, specifically with the kidney. And I'm going to compare echogenicity between the two. I'm going to drop down to the mid-clavicular line. That way I can take my measurement in the same picture, hopefully. Deep breath in and hold, patient. Okay, go ahead and breathe. Here you can see a really nice comparison shot between the kidney and the liver. You can see the liver is hyperechoic to the kidney's cortex and hypoechoic to the sinus. I'm also going to measure here. I'm measuring cranial end to caudal end. The liver couldn't fit in the whole picture. I'm guesstimating it ends right about here. And the liver measures 18.3 centimeters. Next, I'm going to look at the liver in a transverse view. First through the left lobe, sweeping from superior to inferior. I'm decreasing my depth, adjusting my focus. Can you take a deep breath in and hold, patient? So first I'm focusing on that left lobe. I can see the hepatic veins on the left side of the screen to show more of that left lobe. Next I'm looking at the portal system here. I'm going to sweep down. I'm going to see the ligamentum teres coming off here. So I'm going to decrease my depth here a bit. Next is a picture of the pancreas with the liver. Okay, go ahead and breathe, patient. I was trying to show both the pancreas and the liver, and I can see it a bit here. I didn't want to go too off axis to where I'm not in true transverse anymore. So I had to find a balance between the two, and really the liver's more important. Next, I'm going to look at that lateral edge here, like I did before with the left tip. I'm going to sweep through it to make sure I don't see anything pedunculated off of it. It looks good, so I'll take that image right through there. Next, I'm going to look at the right lobe of the liver in transverse and sweep superior to inferior once again. I'm increasing my depth. I'm going to ask the patient to take a deep breath in and hold, please. So for the first image, I want the no man's land. There's not much going on here. Right about here. I'm going to sweep down to where I see the hepatic veins on the right side of the screen here. And I'm going to keep sweeping to where I see the portal vein come into view here. I'm going to keep sweeping down. Breathe, patient. When you're ready, deep breath in. After the portal system, you're going to start to see the transverse kidney come into view here. You can also see the gallbladder there. Okay, patient, breathe. All right, so next I'm going to look at the vasculature of the liver, specifically the main portal vein first. I'm going to go from an intercostal window for the main portal vein. That's where it looks the nicest at for color and for spectral. So I can see it really nicely elongated through here in grayscale. I'm going to turn my color on, adjusting my color box so I can fit a lot of it. And it looks really nicely through here. I didn't even have my patient taking a breath or anything. I just caught it in between the patient's breathing. I'm going to take a color picture there, and then I'm going to do a Doppler signal. Just hold your breath there for a second. I'm having the patient hold their breath so that it doesn't affect the signal here. Decreasing my scale a bit. Okay, go ahead and breathe, patient. So this is good. The flow is above the baseline, continuous, and the flow is hepatopedal going into the liver, which is what we want. Next, I'm going to look at the hepatic veins. I know from my sweep they looked really good from midline. So I'm going to start there. Deep breath in and hold when you're ready. I see it really nicely in grayscale, turning on my color. Okay, go ahead and breathe. Looks good. I have all three filled here. Just a little nub of this right one, but it's enough. You can see it's patent. You see 1, 2, 3, they're all filled. I'm going to take a picture, and I'm going to Doppler one of them. Whatever one looks the easiest. Deep breath in when you're ready. go ahead and breathe, patient. So the flow is multiphasic. It is mostly below the baseline, and it's a hepatofugal moving out of the liver and into the IVC, which is what we want. Now I'm going to look at the common bile duct. So I like to find the common bile duct by elongating the IVC in sagittal, and then I can see the portal triad just anterior to it. Here I see what we call Mickey Mouse. That's the portal triad here. We see the portal vein is the head of Mickey Mouse, and the common bile duct and hepatic artery are Mickey's ears. So I'm in sagittal right now, and I'm going to kind of twist my probe here a bit in an oblique plane to elongate the two ears, and then I'm going to turn my color on to see which one is the common bile duct, because that one will not fill with color. Okay, go ahead and breathe. So I can see the common bile duct elongated really nicely through here. It's going into the panc head over here. Took a picture there, and now I'm going to measure from inner wall to inner wall. It's measuring 0.282 centimeters. And that concludes my demonstration of the liver. Thank you.